Hello everybody. This is episode 6. Our guest today is Dr. Carleara Weiss, expert in behavioral sleep medicine and circadian rhythms.
Thank you so much for having me here, Dr. Liana.
I'd like to start with the first question about this digital age, and we're overly exposed to blue light, especially those who are working remotely during pandemic. And how blue light affects health?
That's a very great question, especially at those times that we are facing now. Sometimes the only source of communication or even entertainment that we have is through our phones or tablets. Blue light that those electronic devices produce, it's very harmful for the biological clock, for our circadian rhythm. So the biological clock that we have in the hypothalamus in the brain is called suprachiasmatic nuclei. So it's just a small structure inside of the brain that controls our biological rhythm in the 24 hours of the day. And this clock inside of the brain communicates with the exterior through the retina. So when there is light in the environment, our body understands that it's day. So it has all the physiological and cognitive functions for the day. And when it's dark, this biological clock understands that it's night and produces melatonin that help us fall asleep and stay asleep during the night, among other processes, but this most related to sleep. And what those electronic devices do is that they produce the blue light that is the most powerful type of light to suppress melatonin. So what we're doing through the day is just giving this stimuli to the brain to stay awake and alert. And if we have this light exposure at night, we are also increasing the suppression of melatonin. So it makes more difficult to fall asleep. It makes more difficult to stay sleeping during the night. So it's very harmful for our health.
And also I have read the latest research about short duration of sleep or poor quality of sleep could be linked to obesity. So melatonin is not only regulating our circadian clock, but it's also a fat-burning hormone. How robust is the study, and can you tell us more about it?
Yes, so melatonin, when sleep is starting to have this powerhouse as a research field. The first thought we had is that melatonin, it's only for sleep. But it turns out that because it's a hormone produced by the hypothalamus, it is associated or has relationship with other hormones. And not only that, every cell in our body responds to the biological clock that we have in the brain. The time that we do all the other activities affects the time that our biological clock understands day and night and have the regulation for all physiological activities too. So for example, there are studies showing us that the immune response for different types of antibodies is different throughout the day and throughout the night. The same way, the response to certain medications is different during the day or during the night. And when it comes to obesity, it's the same thing. So we have melatonin regulating sleep and wake and implying also in wakefulness, but also insulin and glucose have a rhythm during the day and during the night. So it's important to know that, for example, eating too late during the day or eating in the early hours of the evening is going to affect the natural rhythm of having insulin and glucagon being produced and used in the body. And with that, it's increased the risk for obesity and for diabetes.
That's the link with melatonin, insulin, glucagon, and all these hormones interact with each other. They give signals, and that's how they feel like they're awake because of the blue light exposure.
Yes, they are all correlated. For example, the time that the person has dinner or lunch or breakfast also affects that. And the time that somebody has physical activity can also affect that as well.
So consequently, it leads to chronic diseases, cardiovascular diseases, right? Diabetes type 2 and all kind of other health conditions.
Yes.
Right. So there are some tools available that, for instance, blue light filtering glasses, red light therapy. Of course, it is advisable to reduce screen time. Is it something that could be applied complementary with reduction of screen time? Would you advise the listeners to wear blue light blocking glasses or get the red light therapy device?
I would be very careful advising them in a general standpoint. I think, as a general orientation, the best option is to avoid electronic devices at least 1 hour before going to bed. That's the general recommendation that I can give. When it comes to using the blue blockers, that those glasses that block blue light, or even to recommend light therapy, either with a bright light or with a dim red light, it needs to be analyzed with case by case type of blocker, and the timing for this blockage vary according to each patient. So as a general recommendation would be just avoiding the electronic devices with the blue light at least 1 hour before going to bed. And that would be the starting point for further evaluation and more guidance.
That's a great advice. Already, I am trying to follow the sleep hygiene. I'm not taking my phone in my bed. I'm putting in the living room. And before sleep, I try not to have the phone with me. But it's quite challenging.
Yes, it's difficult. It's difficult to put that in practice. And I have to say, like when I first started my training in behavioral sleep medicine, it was difficult for me too. Even though I was learning all the health consequences about it, it was difficult to get that. But today, if I have exposure to bright light, I feel the difference right away and during the night and the next day. So it's a very, very valuable thing to do for our health.
Yeah, and next day you would feel more alert and something that we need to function well during the day. So, tips for new mothers and, of course, shift workers or in healthcare, firefighters, and all this kind of jobs. What kind of advice you would give to improve their quality of sleep? Because we all have broken sleep, like I do. I'm a new mother as well. So, how can we compensate during the day?
First of all, congratulations on being a new mom.
Thank
Yeah.
you.
Yeah. So for new moms, the advice, I would say two important things. When the baby is born, the biological clock or the circadian rhythm is not well established yet because the visual and the non-visual pathway for the newborn are not totally formed. So we're gonna start seeing a little adjustment around 3 months, but it's only gonna be totally formed by 6 months of age. So if the baby is less than 6 months, it's very difficult to find a rhythm. And between 3 and 6 months is where we start seeing a little difference on really understanding day and night because they can see the light better, they can perceive the light better in the environment. So with that said, for the new moms, advices, for example, when changing the baby during the night or when nursing or feeding this baby in the night, don't have the bright light turn on in the bedroom because that shuts down melatonin for that new baby. So as much as we can try to give stimulus with light during the day, and then start having a routine for a bedtime and just reducing light again as you go during the night to check on the baby or to change the baby, have minimal light for that. So you start consolidating the melatonin during the night and sleep better through the night. Another thing that is interesting for new moms is having those have a schedule for doing things because I know that when the baby is still too young, it's very hard to do that.
Yeah.
But just keep that in mind. As much as possible, try to implement schedule for the baby to have things done at a certain time of the day. That also helps them consolidating and differentiating day and night. And for shift workers, the best way would be, if possible, to have a fixed schedule, so they know what days they are doing the night shift and what days they are doing the day shift. This is not always easy to do. Most of the times they are on rotating night shifts, so some weeks they work 5 days, other weeks they work 3 nights. So it's more challenging for the body to adjust to that. What I would recommend for them is the nights that they are off, they try to be consistent with bedtime and wake up time. And again, follow that orientation about not having light at least 1 hour before going to bed. And the nights that they are working, is not going to be possible to follow that rule, but the nights that they are off, they try as much as they can to make a consistent schedule for their activities and for sleep and wake up time.
Mm-hmm. Yeah, it's quite difficult, especially when you're a shift worker. And mothers, yeah, they have like everyday shifts.
Yes.
That workload, of course, varies between shift workers and mothers. You know, to function well, it's important to be alert during work, night shifts. So they have to follow the healthy lifestyle.
Yes, yes. Try to coordinate that as much as they can. Also recommend for physical activity during the day when they are off from the schedule, because that helps with the sleep homeostasis. So being more active during the day is going to help them fall asleep better the night that they are off. So physical activity is also a good recommendation for them.
Mm-hmm. So healthy lifestyle, eating healthy, of course, would be advisable.
Yes.
Yeah, and the one last question I'd like to ask about a power nap. Some people misinterpret the power nap. They think it would last 1 hour or more in hours, but it is known that 10, 20 minutes or 30 minutes, no more than 30 minutes is a power nap. Can you tell us what is power nap and how it could affect us, how powerful it is?
That's a great question. There's one study from a colleague of mine that just came out this past week talking about power nap and caffeine, but I'm gonna get to that. So power nap is the nickname for a short restorative sleep. So just as you said, less than 30 minutes is ideal, or 30 minutes maximum is the ideal for power nap. And that's why we recommend to be 30 minutes at the most, because we want to have that first stage of sleep, just having the light stage of sleep for physical recovery and just for having the brain refresh a little bit. But we don't want to go to the deep stage of sleep, or else when we wake up from 1 hour, an hour and a half of sleep during the day, two problems happen. The first one, that we wake up feeling more tired and more confused and less alert than we went to take a nap. And the second is that we mess up the sleep for the night, that night. I always tell the patients here that napping is like having a snack before dinner. So if you have a snack before dinner, we're not gonna have enough, not gonna be hungry enough to have a full meal. So what's gonna happen is that you have too much of a snack, just a little bit of dinner, and then you need more snack because you're not totally full. So we wanna control the duration of the nap, just so don't have that snack before dinner, just have the duration that's gonna be helpful. And the second thing is how, for example, shift workers can use the power nap to help them stay more alert during the shifts as well. So this study that just came out of a colleague is comparing two groups of shift workers. One that did the full 8-hour shift of work, 10-hour shift of work without a nap and consuming caffeine. And the second group, they took a 30-minute nap and they consume caffeine and they perform better. So just reinforcing that information that we have, that physiologically we can recover performance and physical performance, but also mental performance and memory and attention with that 30 minutes nap. And we know that caffeine is also a stimulant. So caffeine can also help stay more alert during the night shift. But for somebody that is not doing a night shift, we recommend doing this power nap for 30 minutes at the most, and always before 3 p.m. in the afternoon, because that does not affect nighttime sleep that they're going to have later on.
That's a great advice. It's very freeing, especially for shift workers. I think it would be more recommended to have a power nap, right? It's not necessary for
Yes.
everyone.
Yes. So for shift workers, we recommend that power nap, and also for people with chronic insomnia. So, for example, we have patients that we follow daily, and they have a sleep diary that they input their sleep information there. So, somebody that has a recommendation of 8 hours of sleep per night, but is only got 3 or 4, I do recommend that person to have a power nap during the day before 3 p.m. so they can physically recover, refresh their brain a little bit, but then don't mess up the sleep for that night. So we do recommend in those cases as well.
Perfect. Absolutely. I totally agree with that. I actually had argued with my husband recently. So I'm like telling him, power nap, please. Better to stay alert and, refreshed during the day, because you get more tired. That's true. Would you recommend for mothers as well? Yeah.
Yes, definitely. Because as I said, if you feel comfortable with 8 or 7 or 6 hours at night, you're only getting 3, you're definitely gonna need that power nap if you can. Take advantage of the time. If you can, take advantage of the time when the baby is taking his nap or her nap, and then take that power nap for yourself as well.
Yeah, the problem is that I want to use that time to do my side hustles and, some other stuff, whatever I'm working on. So yeah, I will have to somehow think about my sleep hygiene as well.
Yes. And I totally understand, especially for new moms. It's so much pressure about the baby, and the work and the career is so much to deal with. But if whenever you have a chance to do that, I totally recommend that you do it.
Perfect. I think we're done. We covered everything briefly. Thank you for taking your time and joining me. How can the listeners find you in social media?
Yeah, so I have professional Instagram accounts that I post information about sleep and how it relates to other health outcomes. And I try to write in a very simple and easy to understand way. So that is Dr. Weiss Sleep. So everything I try to post at least once a week. Just sometimes I ask what people want to know about sleep. So, and I post results from research from our department and also from colleagues, and try to answer as many questions as possible. And the other option is going through my website, where I have the same information there. Just my website is carlearaweiss.com. And my personal Instagram account, where I also answer questions about sleep, is Carleara. It's just my first name.
Okay, lovely. Thank you very much.
Great.
Best of luck.
Thank you. Best of luck to you. And if you have any sleep questions, just reach out.
Okay.
All the best.
Bye. Take care.
Bye.